I think exercise, but moderately, is really important. So you've talked about it already in terms of sensible exercise from day one, making sure you're not overwalking puppies, making sure that you're being mindful of senior pets. If they're dragging behind you on a walk, maybe you've gone a bit too far, maybe you've gone on for a bit too long, maybe you're going too fast.
Think about the surfaces that they're running on. And one of my pet hates, I'm sorry if it's going to upset anybody, but there we go, is to see people running with their dogs attached to them on concrete. That they can't regulate their own gait and their pace, and you're getting a very constant, frequent concussion on the same joints, and that isn't good for them. So if you want to run with them, run on grass, and where it's safe to do so, which of course we're not supposed to be doing at the moment, have them off lead or have them on a long lead, as long as you're not causing a danger to anyone else.
Please look at your house differently. Everybody is at home at the moment. Everybody's doing DIY. Everybody has decided that they're going to pull their wardrobes out, move their beds around, you know, got time to kill. Just think about the change in environment. And we've spent some time talking about flooring, and I've seen it so many times where dogs come in and they see me as their first opinion vet, and I dig a bit deeper and something's changed. It might be that somebody came to stay and they did loads more dog walking because that person had never been to that village before, so they went to that pub and they went to that shop and they went to blah, and the dog overdid it, or something in the house has changed.
Osteoarthritis is a young dog disease, and that's okay. It's okay to embrace that, because if, as an owner of a young dog, you embrace the idea your pet may have osteoarthritis, may be prone to osteoarthritis, by tackling it now, you can improve your pet's future dramatically. And it's and I think if the opposite of burying your head in the sand and trying to ignore it until your pet is much older, that's the wrong way to go, because then the problem is so difficult to manage,
Always tell people, I always give them advice looking for, call it adverse drug side effects, all those type of things that go along, vomiting, diarrhea, they can happen because of a host of things. Usually it's worthwhile stopping your medication and seeking veterinary advice. Maybe we'll carry on with those drugs. And I've been involved in trials, for example, with non-steroidals, where we've watched liver enzymes for over a year. We find liver enzymes go up 1 week. We retest it 2 weeks later, it's back to normal. We've actually continued the drugs in the trial through these type of things to see what would happen. And you know, as if people own cats, they'll know cats get fur balls, and they pick up a fur ball every now and again. And I always say to people, if they have had cats, what's the chance of your cat vomiting up a fur ball today? Most probably not very great.
Ball checkers. Ball checkers, yeah, they look great fun, and I think they're all right with used sensibly. One of the problems is that they create a brilliant bounce, and these dogs that jump up and grab the ball on the bounce, whether it's thrown from a chucker or not, if you watch what they do, they twist their spine from the bottom of their chest and the lower back, and that impacts a short muscle that runs between the bottom of the chest and the pelvis, and it's what we call the sublumbar muscles, and they can become very painful. And you just watch next time a dog does that, they leap, they twist, and then they crash to the ground. And when they do that repetitively, they're not only putting repetitive impact on their joints, think about footballers, but they're also straining their muscles. And of course they'll carry on doing it because they're having fun. So be sensible about ball throw, use hide and seek games. If the dog's already got arthritis, or small amounts of rolling. Some dogs are just happy to carry a ball around, and then every so often do a small amount of throwing. So be sensible about it. We tend to give our dogs a lot of driven exercise rather than allowing them to do their own thing.
If you want to give your dog something that might be beneficial to their arthritis, but you don't want to spend any money, then use fruit and vegetables. Use fruit and vegetables, dried berries, to try and increase the number of antioxidants they're taking in. Because the fact is, how much stuff do we throw away every week out of your fridge because you've got too much of it? Just cook it or blend it up and add it to the dog food, because I think we undervalue in dogs, because we're so we feed an awful lot of processed things. I think we sometimes undervalue the value of real antioxidants, and that's so easy and usually is going to cost you no money at all.
Yeah, absolutely. Is to use the It's My Home 2 tool on Cam. We have this great tool where you can go through and work out ways that you can change the home environment to improve it for your pet. Lynn's actually tagged more rugs, less drugs, which is so true. You know, slippery floors are can be a real pain. It's a nightmare because when you've got a young dog, carpets are the worst because they poo all over it. So you get rid of all the carpets, and then as they get older, all they need is carpet, and the slippery floor is a nightmare. Yeah. So yeah, and it's not nice to seeing them skidding around. So do just use rugs that are easy to clean. That would be a big tip of mine.
You know, a senior dog, a physically compromised dog, let them be a dog. They have to be a dog. Don't take that away from them. Their quality of life, they need to do the things that make them a dog. And that can be achievable even if they're arthritic or uncomfortable. There are things that we can do to help. There are things you can do at home to allow them still to be a dog. A dog needs to stop and sniff on a walk. It needs to get out of its home environment. It doesn't need lots and lots of exercise. So you might drive your dog down to the park and it might have 10 or 15 minutes of meandering through the grasses and sniffing at lampposts and things. That's amazing. That is all that dog needs. But to your dog, mentally as well as physically, that's incredibly important. So we can't wrap our dogs up in cotton wool. You know, when you get a diagnosis of your dog and it's all very overwhelming, and you know, we immediately as humans assume the worst, and then we work our way back to a sense of reality from there.
So I would say that as we've been talking about, arthritis is a disease that affects their mobility, their pain sensation, their temperament, their behavior, how they eat and drink. So you need to involve people who can address all those problems. So your first opinion vet is a key player in sort of coordinating all of this. But ask them which physio they would recommend. Ask them about diets. Lots and lots of first opinion vets are really good at managing pain now. But if you feel that they're not getting the results that they wanted, maybe suggest going to see somebody that runs pain clinics, or maybe just ask your vet to have a telephone call with somebody that runs pain clinics to see if they've got any other ideas.